My name is Michael Bending and I'm from Sydney, Australia. I was diagnosed with stage 3/4 esophageal and gastric cancer last May. Well, I've got a degree, a Bachelor of Health Science. In Australia, they wanted to do full chemo for 3 to 6 months, my full body chemo. And then they wanted to take out 1/3 of my esophagus and my whole stomach. It makes it very hard to eat or digest food and not easy to sleep because your stomach and esophagus stretch. So it's not something you want to live with for the rest of your life if you can avoid it. China was the only place I could get SDT, which is Sonodynamic Therapy, combined with localized chemo, which is called chemo embolization therapy, where they cut off the blood supply to the tumour and try to kill the tumour locally exactly where the tumour is in the tissue, rather than put it through the whole body. And they also combine ozone therapy with that. So you've got 3 therapies working together against the cancer.
首先呢，就是我们先介绍一下，说我们这个动脉内这个灌注或者栓塞化疗，可以将药物的浓度提高到非常高的水平。比前身化疗这个药物浓度会要高得多。
In January, I hadn't started the chemotherapy. I hadn't started the localized chemotherapy. I was only doing the SDT, and we were only making smaller progress. And then I started the SDT with the localized chemo, along with the ozone, and all my pain went away. I could eat, because in January I couldn't eat. I was vomiting up food. The pain was intense, and it really was a hard time. And as soon as I had the localized chemo, within a couple of days, I was hungry again. I could eat. There was no pain. I thought, wow, this is pretty amazing. The facilities are great. It's like staying in a luxury hotel. And the doctors and nurses are really wonderful. And on our floor, the international level, they all speak some level of English, but they've all got really great translators. Oh, look, just thanks for all the hard work you guys have done. I know it's not easy for them too, because when you have so many international people, so it's not easy for them to understand all the different languages. And also, we all have different needs, different foods or different things that we need done, like passports need to be updated. And thanks for all the hard work they do. And I actually think that in future, in the next 20, 30 years, we'll probably see a lot of Westerners come to China for medical treatment, because China will be probably the only place that will offer cutting-edge technologies. Cancer's a difficult disease. It's not like, and even for myself in my medical background, I thought I knew a fair bit about cancer, but I realised I knew very little in the beginning. Cancer is one of those things that, firstly, you're up against the clock. As soon as you're diagnosed, the clock is on, the clock is ticking. And a lot of us, and myself included, thought that, I've got a lot of time, I can just relax. But what I found in my research is when we do get the diagnosis of cancer, generally the cancer's somewhere between 2 to 4 years already progressed. All I'd say is just act quickly, try and do as much research as you can, and that's what I would, that's my advice to people.